Yeah, I'm Dr. Song Luo. Yeah, I'm a faculty in AOMA. I've been working here for more than 10 years. Yeah, I treating patients in professional clinic and also supervise students in a student clinic. And also I do giving class every week for our students. Actually, in order to explain TCM treating the stroke patients, I maybe explain my history of the clinical history of stroke in China. In China, I work in a state hospital. In our hospital, there are one of the neuro center. Okay, they have more than 500 beds there. So they have a lot of stroke patients and other neurological disease patients. Some patients is very complicated, and this came from other hospitals they cannot handle. So every Friday, so many patients from other hospitals were sent to one of the conference Friday afternoon. So professor were guiding all the different neurologists discussing each patient. How about diagnosis, and how about the treatment plan, and what's your idea about the prognosis. So during that 13 years working in a state hospital and also neuro center, so I actually noticed acupuncture could help a lot of patients, especially stroke patients, neurologic patients. Yeah. So every day we're treating around 30 to 50 stroke patients in a neuro rehab center. Yeah, the stroke could be very early stage, yeah, even in the ICU. I'm working there for almost more than 10 years. And also the acute stage, and also rehab stage. So we have a rehab center right now, the building in our hospital. So actually, just during the 30 years, we have experienced all the different stages of the stroke patients. We found that acupuncture could very effectively help the patient's muscle strains and muscle tone. Combined with other medication, other physical therapy, acupuncture will help the patients stand up much early and is walking much better. And this is why I decided to treat a lot of stroke patients here in the United States, because here actually many patients didn't notice acupuncture could help stroke patients. They have other therapy after the stroke associated with the physician, but they didn't know acupuncture could really help a lot. I think through our introduction, I hope the patients and also all the different hospitals, all the clinic, they could combine acupuncture to help stroke patients. So more patients in the United States, especially stroke patients, will benefit from this. Stroke is one of the diseases and the three high disability, high mortality, and high incidence. Okay? So actually acupuncture could decrease the incidence, and also could help the patients function during the recovery stage much better. Okay, how could they do this? Actually, acupuncture could help based on the research, could help the patients muscle strength improve, and also help muscle tone improve, and also control the neural cell edema at a very early stage. So all of this will combine together, could benefit the stroke patients. And we have different techniques during stroke treatment. For example, we could use only regular needle to stimulate some points which peripheral nerve is accumulated. Some special acupoints. We also could combine other electric treatment under the safe condition. And also we could combine other, for example, moxa or massage or other different very traditional technique to help stroke patients recover much faster. So we have different technique. If you came to clinic, you will notice how traditional Chinese medicine could help you. Actually, the prevention of stroke is very important. Stroke, what causes stroke? So there are several very important risk factors. First important is hypertension. And the second most important is a patient's cardiac disease. And also the third could relate to the patient cholesterol, high cholesterol. So acupuncture actually could help all of these risk factors. For example, hypertension, acupuncture could through treating liver channel, kidney channel to make the patient's blood pressure getting lower. And also acupuncture could help the water and damp metabolism, which could help lower your cholesterol. This is actually another thing very important. For the heart disease, we could choose some heart channel points or other lifestyle suggestion to guiding the patients, make the patients, heart attack incidence getting less. For example, there's some patients, atrial fibrillation is one of the important reasons to cause embolus, which causes ischemic stroke. So acupuncture and Chinese herb could help to control this, which could lower the incidence of the stroke. And through all these kinds of acupuncture treatment, massage treatment, lifestyle change, we could prevent a stroke attack. Stroke patients, many patients before they got stroke actually they're pretty active. They clean, they do a lot of the work. They cannot stop doing anything. But actually after stroke, we see a lot of patients because they cannot move. They have to lie on the bed looking at the ceiling. So they're very, very depressed. They're crying all the day. They cannot accept, they cannot move anymore. So in order to help this, actually, Chinese medicine acupuncture will treating based on the 7 emotion theories. In Chinese medicine, we have these theories for many, many years, already thousands of years. It's based on your liver, based on your heart. Different organ either has a heat or cold or excess or deficiency. They set up different plan, try to help the patients go through this process. Clear more of the heat, make the patient could calm down and more relaxed and more cooperative with the treatment. Actually, this is all from another perspective to help the recovery of the stroke patients. We could use a regular needle. We could use a scalp needle, not only on the body but also on the scalp. And sometimes we could use even ear points combined together to deal with these kind of patients to help them control their emotion. I think this is a very good question. How to integrate the West medicine and Chinese medicine in the United States. Actually, right now, acupuncture in the United States is already more than 20 years development. A lot of the physicians, neurologists, physical therapists, they already noticed acupuncture could help stroke patients. Many physical therapists and clinic manager, they already mentioned this. They already noticed this. Right now, the issue is they mostly send the patients to AOMA clinic. This is very good. They get physical therapists and language therapists and doctor and neurologist treatment. Then they send to here regularly time. But on the other hand, with the entry, still has another way to cooperate this, which may benefit more for the patients. And because some stroke patients, they cannot move, especially in the early stage. It's impossible to send to the AOMA or any clinic outside the hospital. If, like in China, actually, most of the hospital, 99% of the hospital, they have acupuncture department in that hospital. So when they need acupuncture, they could directly simply give a call. Then the acupuncturist will go to different departments. For example, I go to ICU, I go to neuro center, I go to all the other departments. And we have more than 38 departments in the state hospital in China. So actually they benefit a lot. Benefit from patients, benefit from their department, everything. This cooperation actually is win on all the sides. And here I think it's still the same. Just in the hospital right now, they may haven't found a way to how to cooperate and integrate acupuncture with their regular traditional treatment together. But I hope someday when they notice acupuncture really could help improve the life quality of the stroke patients. So more and more hospitals could accept acupuncturists, and either the student clinic, either professional clinic, they could combine together to treat more stroke patients in the hospital. Right now, I think that the northern part of the United States, some states, they already invite some acupuncturists in their clinic, but maybe not too many in the hospital yet. But I think this would be very promising, not only from the hospital, not only for AOMA, but also for the stroke patients themselves. Another stroke example, from China, a state hospital in China. There's one neurologist. Actually, she is the director of the neurology department. She got stroke right after going back home. She lived in the hospital, so it's very close to the neurology department. After the stroke, she called her family and her neurologist department, called me. Then I gave acupuncture at the very early stage. Right, associate all the other neurologists. When they send to the MRI test and CT test, has eyes put around the neck. At that time, I started to use some scalp needle. So also in ICU, I treat this neurologist when she lost consciousness, and either help or get treatment either. So finally, this director, this neurologist, they recovered very, very well. Most stroke patients, sometimes the finger function cannot be completely 100% recovered. You could see some difference compared to the normal side. But this neurologist, because it's treating with acupuncture in other departments so early, she completely recovered. If she didn't tell you she got stroke, no one could tell she got stroke. She recovered really, really very, very well. She also see the acupuncturist how well it is. This is why I've been invited to the neurology department many times. We don't have time for lunch. We go there. It is around 9 o'clock, 10 o'clock, then finish maybe 4 or 5. We just go different store because the neurology department has 5 floor. Store. So we have upstairs, downstairs, and also I'm invited to the other department, internal medicine and surgery, orthopedic, all the different departments. So pretty busy. I think here, any hospital, they still could do the same. Some AOMA graduates, they're already be invited to the hospital. They're treating in ICU, they're treating emergency department. They write some paper already be published in the northern part of the United States. I think the other hospital, especially in Texas, we have a very excellent acupuncturist and very excellent school, AOMA. You definitely have a chance to cooperate and have more patients benefit from that. This is needs some efforts together to make it come true. May is a Stroke Awareness Month in the United States. So if you have any family member or friends or yourself has any sign of the stroke, or you want to prevent a stroke, I think it's a very good time to call AOMA clinic, and student clinic and professional clinic, or you come here directly to visit us. I think we'll try all our best to help you prevent or treat the stroke in different stages.